Hey guys, today I wanted to talk to you about what is in my nursing bag. As a Drexel A student, we all get this nice bag, and it's part of your lab fee on your bill. And in this bag, you get all the things you need for clinicals and for lab. So I am going to show you what's in my bag today. Okay, so you get a stethoscope. I should have probably organized this, but it's whatever. Alright, so you get a stethoscope. It's a Littman. It's pretty nice and it's very good quality. And you get a little name tag to go with it so you can write your name on it. So just in case you lose it in lab, you can find it back again. See, I have mine here. I have RN because every time I see RN, it just motivates me more. And it makes the dream even more real that I'm going to be a registered nurse in less than 11 months. Yeah. Okay, so that's that. You get a Littman stethoscope, so you don't need to buy another one unless you want to. You get a blood pressure cuff. You get this nice navy blue blood pressure cuff that comes in your bag. You'll be using this during lab and clinicals to practice taking blood pressures on your patients and also on the dummies in lab. So yeah, it's a blood pressure cuff, comes in your bag. And I have this, you get this in your bag. It is a tracheostomy care. Mine is already open because I used it in lab already. But yeah, this comes in your bag to do trach care. You get a Foley catheter. It's like, of course, mine is already open because I already used it in lab to insert a Foley in the dummy. So yeah, you get that for practice. So yeah, this is a Foley. It has the Foleys inside the bag and all the stuff you need to insert a Foley in here. So that's also in your bag. In first quarter, you have to do injections and medication administration. So in your bag, you get all this practice injections and needles. And also, you get this band-aids in here too. There's like a bottle of sterile water to use it to practice. The needles in here are very, very dull, so you can't really like poke much. And there's also like tape in here. There's a lot of stuff in here. So this you'll use your first quarter. It's like a lot of injection stuff in here. You get a sterile gloves. You can use this to do the trach care and also for the Foley, and you get measured for this when you get your bag. So you get one sterile glove, and you get suctioning. You get a suctioning kit for suctioning trachs. It's in there. Mine is already open, like I said, because I used it already. So here's your kit. Yours is probably gonna look nicer because it won't be opened. So yeah, suctioning kit. And then you get all this sponges and gauze and all these cool things in this Ziploc bag that's part of your bag. We didn't get to use this first quarter. This is pretty much like your wound care things you would need for your wound care. We did wound care in lab, but it was like one day. So there's really much, I can't really say much about this. We didn't get to use it yet. So maybe next quarter, in quarter 2, we'll probably be able to use it more. But yeah, it's just a lot of gauze and band-aid and sponges and stuff. Pretty much it. Yeah. Sponges. All these Teflon, Telfa, Ochlus, yeah. Adherent pad. Yeah, this is mostly stuff for wound care. And then you get the personal protection stuff. So this is your gown, and you get a mask in there too that you have to learn how to use properly if somebody has a contact precaution. So yeah, so this is a gown and there's a mask in there too. So yeah, And then you get this other Ziploc bag where you have your Snelling chart, you get your reflex hammer, and you get one tongue depressor. I have two in here because I took one from lab. Here's your Snelling chart, and then also alcohol swabs, but those don't come in there. I took that from lab too, and I just never used it, so it's in here. And inside of it, you also get pen light. Get a pen light. You use it to check the ears. Cool pen light. I love using my pen light. And that comes in there too. Well, this bag was for your. You get this bag where your blood pressure cuff is in. I don't use it anymore because it's just annoying taking it out. And you get a wound measurement thing here. Like I said, we learned about it, but I haven't really used it in practice yet. So it's a wound measurement guide, so you can use it to measure the wounds of the patients, especially like pressure ulcers and stuff. And this doesn't come in your bag, but you will get it in like the first week of lab. It is your lab manual for N200, and pretty much everything you need to know for lab will be in this book. And what we're doing, like, it's in order for like in each week. This is also for clinicals too, so you get this book. And I think that's pretty much it for like the stuff in my bag. So here they are again. So you get a blood pressure cuff, stethoscope, wound care stuff, suctioning for trach care, Foley, practice injections and medicines, and pen light, reflex hammer, and a Snelling chart. So you pretty much have to take this bag, and they all come into this awesome bag. I actually like this bag a lot. Yeah, this is the bag it comes in. So you have to bring this bag to lab, and to lab every week. You only have lab once a week, so you only have to carry it once a week. Usually you don't take it to clinicals because there's not that much room at clinicals to take it with you. So you just take out whatever you need and you come to clinicals. I've seen people bring it to clinicals. It depends what site you're assigned. And also, part of Drexel, you have to wear your uniform. This is your scrubs. It will look like SpongeBob in your box scrubs. So you have to buy a yellow top with the Drexel emblem on there. It says Drexel. This one is like one of the old versions. I got this from somebody who already graduated because I don't like to buy stuff I'm only gonna wear once I'm done with this program. So I got it from this girl for free. But you can buy it. Drexel will give you the site where you can buy it from. And yeah, so it's pretty much yellow top right here. It just has to say Drexel Nursing on there. And also you have to have navy blue pants. That you can buy anywhere. I bought this one at Walmart for like $8. It was on sale, so I bought like 2 of them, and I have 3 of these. So it all depends, and you only wear these once, so there's no reason to go. I mean, you have to wear it for the whole year, so you buy as much as you need. The tops are pretty expensive, but the pants you can buy from any store that sells navy pants. And also, as part of your uniform, you have to wear white shoes. I don't know why you have to wear white, because white gets so dirty so fast. I bought these shoes from like the site that Drexel sends you to buy all of your uniforms. I think it was like $34, and those were the most waste of money I've ever spent. I wore it like one time, and it gave me a blister, and I ordered the right size too. It gave me a blister the whole day, so I give up on that one, and I went to Walmart and bought these shoes for like $9. These were $34, and so painful. I don't know if anybody wants some, let me know, because I don't wear them anymore. They just stay in my closet. So I bought these things, and they were so comfortable. Drexel don't care as long as it's white. That's all matters. Obviously, this doesn't look white anymore because I wore it so much. So, but they were cheap and they were comfortable. You don't need to buy anything fancy. You also need a watch as part of your uniform. I don't have my watch right now to show you, but it doesn't need to be anything fancy. You just need it to have the seconds. You need a watch that has the seconds on there. It doesn't have to be digital or dial-up. Just as long as you have the seconds, because you'll be taking, you're going to be taking heart rates and respirations, and those you need to measure. You need to be able to count the seconds or the minutes, whatever. Just make sure it has the seconds handy, and you'll be fine. So that's pretty much all you need for Drexel in terms of uniform and what you get in your bag. So you don't really have to buy. Only thing you need to buy is just your uniform, your tops. But try to get some from people that already graduated. That's how I went about it, because I hate spending money unless I have to. So a lot of kids, they graduate and they don't use it. They're not